Good morning, everybody, and thank you so much for joining us on this chilly morning. Today, we're going to have Hayley Mueller, our Park Nicollet Foundation Executive Director, present on our exciting new strategic plan for Park Nicollet Foundation. And so, without further ado, Hayley, I'll welcome you to present. Thank you so much.
Awesome. Well, thank you so much, Abby. I'm hoping you can all still see my slides. Please just shout if you can't. As Abby said, I'm Hayley Mueller. I serve as the executive director at Park Nicollet Foundation, and I am just thrilled to be here with you today to share an update on the Park Nicollet Foundation strategic plan. We have been at this work for really the last year, and we're just thrilled to be kicking off 2025 with a brand new plan. As Abby said, if you have questions, please put them in the chat or in the Q&A. I will make sure that there's time at the end to answer any questions you may have. But I'm going to just run through a few slides and look forward to a discussion at the end. All right. So to kick us off, I thought it would be helpful to talk a little bit about why a strategic plan now. Park Nicollet Foundation has been around for 50 years. We celebrated our 50th anniversary last fall. And over those 50 years, we have done incredible things at Park Nicollet. All kinds of wonderful supports for patients, caregivers, capital, you name it, we have funded it. But we haven't had a strategic plan in over 10 years. And so as I came into my new role as executive director, it was really important to me that we work on a strategic plan to give us some direction as we launched into our next 50 years. We had a little bit of a Wild West way of operating, and I don't mean that at all in a negative way. In fact, I think in some ways it served us quite well. But in the absence of guardrails and priorities, we just kind of did things as they came to us. And there's nothing wrong with that, but given lots of competing priorities in healthcare right now and the need for the foundation to really support the system, it was time for a strategic plan that gave us some guardrails and priorities to help us make decisions. This will also give us, again, that clear direction as we launch into our next 50 years and will help us raise awareness of Park Nicollet Foundation. We are very much kind of a hidden gem at Park Nicollet, both internally and externally. We have lots of internal partners who know who we are, but there are also many who have no idea that they might be able to access funds here at Park Nicollet Foundation. And then externally in community, again, we have lots of longtime partners, friends, donors, funders, but also a whole community that doesn't know that there's a philanthropic arm to Park Nicollet. So having a strategic plan really helps us tell that story. And then finally, it's an opportunity for us to really strategically and intentionally align with health partners, our system, so that we can ensure that we're headed in the same direction towards the same goals. So that gives a little sense of why. I thought it would be helpful to talk a little bit about our process. Park Nicollet Foundation, our staff and our board of directors, some of whom are actually on this call this morning, engaged with an organization called Collectivity. And Collectivity is a co-op organization that facilitates strategic planning. They really helped us think about what are our assets? What do we have in community and how can we help use those assets to really elevate the work we want to do? They helped us ask some really hard questions and challenge the status quo and some of our assumptions. So we had an external firm come in and really help facilitate these conversations, which is always helpful to have that third party come in who's kind of neutral and can ask again some of those harder and tougher questions. So our approach to this was really about doing the work together. So the photo you see here is of our entire board of directors and the entire Park Nicollet Foundation staff. So every step of the way, this whole group was really part of the key inflection points in the story. So we did this work with our consulting firm Collectivity. And then we had a strategic approach team. And this was a small core group that really helped make recommendations and drive the process forward in kind of the interim, in between the big meetings with the board. And that included our board chair, Nancy Gelly, Bill Shimp, who is a retired oncologist here at Park Nicollet and was a former board member here at the foundation, Amy Homestead on our team, Pete McNabb, and then myself. So a really small group kind of driving some of the interim steps that needed to happen as we worked through this plan. Additionally, we had, of course, all of our staff and board, and then health partners leadership. Again, it was very important that whatever strategic plan we came up with as a Park Nicollet team really aligned with health partners and helped us move the overall goals forward. So I'll talk a little bit about our process. So this is there's a lot here, and I'll walk through it, but it looks more complicated than it really is. So the very first thing that we did was learn about our current state. What do we know about our first 50 years in existence? Where have we been? We did a strengths, weaknesses, opportunities, and threats type of exercise. We also did some environmental scans, so talking to other like organizations in the community and nationally to understand how does Park Nicollet Foundation look in comparison to our peers in the world of healthcare philanthropy. We also had a number of discovery calls, and these were phone calls that our consultants did with both internal and external stakeholders. So those were questions like, what has your engagement with Park Nicollet Foundation looked like? In your wildest dreams, what would you like to see Park Nicollet do going forward? And that gave us a really good groundwork for what do people think of us today? What are questions that they have? What would they like to see? And perhaps also, what are some of the misunderstandings and misconceptions about the work that we do or don't do in the community? So that was a very big part of this process, was this kind of initial foundation laying. We then moved into some context setting, really understanding what are the constraints of this process? Is there anything that we absolutely have to do? Or is there anything that we absolutely can't continue to do or shouldn't start? We created a vision statement that I'll show you in a moment. And then we did put together a variety of kind of contextual building blocks throughout the process. And that includes things like Healthcare Finance 101 to really make sure that our board of directors was grounded in healthcare finance and how that might impact the future of Park Nicollet Foundation and the role that we play. So we did some of that building block work. We drafted goals, strategies, and metrics, and then we approved our final plan. So I will talk through some of these additional steps here in the subsequent slides. So again, building that foundation. I talked a little bit about the environmental scan. Those were conversations with other healthcare organizations and foundations. Included on that list were organizations like Alina and M Health Fairview. We talked to an organization called Providence on the West Coast. Mayo, we were able to gather a little bit of information there just to understand how do we do our work and how does that look in comparison to our peers. Again, those discovery calls that included all of our board members, staff, health partners, leaders, key donors, grantees. So the folks who actually receive funds from Park Nicollet Foundation, we wanted to have conversations with them as well. And then we did a board training. Part of this process of strategic planning is it's just really important for the board to understand their role in that process. And so collectivity helped us provide some of that important context for our board so that as we set the vision and strategy, everyone knew their role and knew where they kind of fit into the process. And then I mentioned as well that it's typically called a SWOT analysis, but in this case, we called it a SWORT, which was strengths, weaknesses, opportunities, aspirations, results, and trends. And all of that data came out of the discovery calls and the environmental scan. So again, really giving us that sense of where are we and where do we want to go from here. So defining who we wanted to be, this was the next phase in the process. So we did a couple of different exercises as part of this. One was an identity statement, and it was long. It's certainly not something that you would ever use as a mission statement or a vision statement, but it really helped us walk through what do we do, how do we do it, what are the resources that we have in order to reach those goals, and what do we want people to feel when they engage with Park Nicollet Foundation? And that was an incredibly fruitful process that we did with the board. We also did a strategy screen process, and that was really looking at all of the work that we currently do at Park Nicollet. So, whether it's our community programs, our internal patient special needs support, our the work we do with our institute, with our simulation center, and saying, how does all of this fit in to what we heard from our constituents in the discovery session? But also, how does it fit in with where we think we want to go? Is there anything here that doesn't seem to fit or that needs to be looked at? So we did that strategy screen not only as a team, but also our health partners leaders did that as well. And then perhaps the most fun and enlightening activity we did was called the gallery walk. And this was where we took big buckets of work. So again, our community programs, patient experience, innovation and research, capital projects, and we put big posters up on the wall in the auditorium here at Methodist. And each small group walked around and added key priorities, goals, metrics, different things that came to mind in each of those areas. And then we rotated around and had the opportunity to both review what other teams had done, but also add or edit and change things. And so it was a very collaborative process, a really creative process, quite frankly, a really exhausting process to go through to really look at how do we want to show up going forward and what really rises to the top as being areas that are very important to us as we move forward. The left bound, right bound exercise was again really looking at constraints. What are the things that we absolutely have to do and want to do? And what are the things that we absolutely shouldn't do or we can't go there? It's not our role. Maybe it doesn't fit within health partners' goals and strategies. So we gave ourselves those guardrails and they were pretty wide. And then again, that healthcare finance work was just really helpful in grounding us in this process. So next we did the visioning work and we created a vision statement, which I'll share on the next slide. And then in addition to that, we created a couple of tools that I'm not going to show you today. I'm happy to share with anyone who would like to see them after this, but they're very wordy and a little complicated to put on a slide. That includes our theory of change and our logic model. And the theory of change process really was about our vision statement, putting our vision front and center and saying what activities need to happen in order for us to reach that vision and that goal. And so it's a long cascading kind of hierarchy of activities and different things that we can do, but really helped us hone in on what are the things that we need to do to get to our vision, and what needs to be in place in order for those things to be successful. The logic model then takes everything in the theory of change and helps us look at it's kind of an if then. If we've got all these in place, then we need to work with marketing or we need to work with our partners in finance. And then it goes into when do we need those things done and how and what will the outcome be. So really helping us sort of map out the work. Again, very detailed. I'm happy to share, but for the purposes of this presentation, we didn't want to overwhelm you with the visuals of that. We then worked through our strategic goals and strategies, and then our final strategic plan. So this whole process started in November, and our board of directors finalized and approved the full plan in August of 2024. So we are currently in the process of annual planning to kick off 2025. Okay, so as promised, this is the vision statement we landed on. So I will read this because I think it really helps us get grounded in what the strategic goals are. So, Park Nicollet Foundation envisions a world where philanthropic partnerships across Park Nicollet and health partners result in improved health outcomes for the communities we serve through equitable access to exceptional patient care. There's a lot there, but as I look at this, the things that really stand out to me and that I'm very excited by is this part right at the end where it says equitable access to exceptional care. Those are two really clear pillars for us. So as we look at what is the influence and impact we want to have, it's all about making sure that our patients and community have access to the exceptional care they can receive here at Park Nicollet and Health Partners. That's what this is all about. We want to remove barriers. We want to make sure people are having the best outcomes possible. And to the extent that the foundation can help support that, that is what we are all about. So this is a really wonderful tool, quite frankly, for us to use at the foundation to really help us look at what are the things we want to fund and continue to support, and how does this show up in our grants and in the way that we engage in community. So now we're going to dive into the strategic goals and strategies. So this is again an abridged version, but this really will give you a good sense for where we landed. So we landed with 5 key pillars, and I'll walk you through each one. So the first is community. Park Nicollet Foundation has a long history of being really deeply engaged in community. In our geography where we live, work, and play, Park Nicollet is definitely a part of that community. And so we want to look at the community programs we provide. So we have Growing Through Grief, we have our Now Telemental Health, and we have our school-based health clinics. All 3 of those programs have incredible histories, wonderful impact, and we need to really look at how do we make those programs sustainable going forward. So that's work that we will continue to be doing. We're already starting that work now, but really looking at what is the foundation's role in connecting with community? How do we raise the visibility and understanding of our mission and those community programs? And then how do we build a business plan for those programs that really helps them to be sustainable moving forward? We will also want to foster community health, well-being, and again, that access to healthcare and coverage. So every 3 years, hospitals do a community health needs assessment, and you can find the Methodist Community Health Needs Assessment on our website. We just completed a new community health needs assessment that will take us into the next 3 years. But a key portion of that work is really about community health, well-being, making sure that there's access. And so we really want to enhance our role as a resource for community health, and then also leverage our role as a convener and partner to organizations and projects related to that community health needs assessment. So where you see the China on there, that's what that is. So community will remain a key pillar for Park Nicollet Foundation going forward. The next and perhaps newest pillar that you'll see here is around workforce development, retention, and support. So we know that the workforce is critical in healthcare. We also know that it's a major challenge right now. It is really difficult to find healthcare workers, people who are properly trained for the things that we need. And there is a role that the foundation can play in a way that we haven't before. So, a couple of key things looking at identifying and implementing what our role can be in workforce development. So, partnering with our human resources team, help partnering with our education teams to create new partnerships and pathways to healthcare careers. Additionally, how can we enhance the existing educational partnerships that exist? So, Health Partners has a great history of partnering with educational organizations around the community. And to what extent can Park Nicollet Foundation continue to foster and support those? Additionally, we want to identify and implement what we can do to retain and support the people we have. We know this is a really competitive market. Healthcare work is very hard work. It is incredibly taxing. It can be really difficult emotionally, and we want to make sure that we're playing a role in kind of wrapping our colleagues with support and giving them what they need to be successful. So again, really prioritizing education and training. How can we make sure that our team who's here has what they need to be successful in their role? Also, there is a great opportunity for us to leverage research and innovation as a recruitment and retention tool. Lots of people who are in healthcare are really interested in research and they want to study things that are interesting to them or that align with their particular field of study. We can help fund that and make sure that there's time and space for those healthcare workers to be able to do that work. And that makes Health Partners in Park Nicollet all that more um, interesting of a place to come and work and stay. And then enhancing the current employee engagement in participation with the foundation. So I'll share a couple of examples of this later on. But we can really be, again, that support system for our teams. One example that I'll share now is when the tragedy occurred over Labor Day weekend at Park Tavern. This was an opportunity that the foundation could really step in and wrap our colleagues with some love and support. And so we went around with caring carts to every floor of the hospital here at Methodist, multiple days, just providing a little treat, a little something special to just get people's mind off of a really difficult time. And while that doesn't fix any of the problem or the struggle, it is just a bright spot. And we can do more of that to really engage our colleagues and be there for them for their well being. And that also just makes this a great place to work. So that's a unique role we can fill. So again, that workforce development, retention, and support is a new pillar for us, but a really important one and will be increasingly important moving forward. The innovation and research pillar is really about just that, innovation and research. So we want to continue to seed pilot projects. We have folks from all across Park Nicollet who come to us all the time with new ideas, things they want to try, things they think might work, but maybe they don't have the operational support to put it into the budget. We can fund those pilot projects to really give our teams the chance to try something new and learn from it. So we want to continue to prioritize those pilot programs. We also want to continue to prioritize expansion of existing programs that are working. So if we know one example of this is behavioral health consultants in adult primary care. We know that that model works. So is there a world where we can support funding for that same model in a pediatric setting? So our board is currently looking at a grant for that project, and we'll be reviewing that in a couple weeks. So things like that where there's some proven track record, but we can adopt it for a different environment. We want to continue to support those things. Research studies. So we fund research studies here at Park Nicollet Foundation, and often the biggest barrier to accessing larger dollars from larger federal funding is getting kind of that first group of study participants, that first kind of slice of data that can really help tell the story to access larger funds. So we can do that for our colleagues. If they have a research project that they think has some good potential, but they need some initial funding to get it off the ground, we love to fund those types of projects. We also want to explore earned revenue and what are the ways that we can take the innovation and incredible talent and creativity of our colleagues and team and all the things that they create and really lean into that and commercialize that. Is there an opportunity for the foundation to support building those muscles and infrastructure? And then we also want to create public opportunities for support. We have a huge opportunity to tell the story about our Health Partners Institute and the research and innovation that's happening every day across our system. Let's give people opportunities to support that work because it is really meaningful. It is moving the needle on some really important initiatives in healthcare, but we don't tell that story well. So we can tell that story better at the foundation. And then the second piece to innovation and research is really prioritizing and supporting mission aligned capital projects. So we want to partner with leaders to make sure that when capital needs are on the horizon, we know what they will be and we can plan for those and we can support with philanthropic dollars. Our community is very generous. They want to support and they want to be part of these projects that are innovative and different. And so when we can create those public opportunities for engagement and awareness, it really helps move these projects forward. So we will continue to support capital where it aligns with the system needs, and where we can support and leverage philanthropy. Okay, so the final two strategies here are around patient experience and operations. And I will say right off the bat, the patient experience pillar appears to be the smallest. It is absolutely not. It is probably the largest. This is where most of our work happens, is really ensuring that our patients and caregivers and families have an exceptional experience when they're at Park Nicollet. So we like to, again, invest in those transformational and innovative projects. What are the things we can cover that maybe aren't reimbursable? Things that insurance doesn't cover, but that make all the difference for a patient. We want to know about those projects and we want to make those things happen. We also want to support service line needs and initiatives that they come up with. Whether that's programs to support patients in hospice and providing their family with some keepsakes that allow them to have memories of their loved one who is passing away. Or it could be things like patient special needs, support with parking, support with durable medical equipment, those things that weigh heavy on people as they go through a really difficult health situation. If we can lift that burden for people, it makes all the difference in the world. And then we also want to increase the understanding of the variety of patient demographics that walk through our doors. This can also fall under workforce development, but the foundation can support things like culture trainings and different tools that our teams can have at their disposal and the trainings that they might need to be able to support our patients in the way that they would like to be supported. We know that healthcare can be really it's really difficult and it sometimes is scary. And so, to the extent that we can make our environment as welcoming as possible to as many people as possible, the better. So, that's a really unique role that the foundation can play to make those things happen. And then finally, operations. We operate well as a foundation. We're a quite well-oiled machine, and there is always room for improvement, and there's always room for better alignment. So we really want to partner with all of the Health Partners Foundations. There are 8 of us across the system. So really building in collaboration, enhancing our infrastructure around policies and budgeting. How can we do that better together? We want to continue to utilize our amazing board in ways that feels good to them and that's supportive of the system. So we're working on that. We're aligning all of our kind of support services. So marketing, improving all of our fundraising strategies, kind of our back office work, really taking this time to align those with our strategic plan to ensure that we're moving in a good direction and then increasing our volunteer engagement. If any of you have had anything to do with volunteering at Park Nicollet, first of all, thank you. But we have the most incredible volunteer team, and they have just incredible ways of engaging our volunteers in meaningful work across the system. Whether volunteers are doing discharge or doing tours of our family birth center or supporting at our St. Louis Park Clinic or TRIA, they're all over our Park Nicollet system. And we there's such opportunity to really continue to elevate that work. And then, of course, we want to align our data and our key performance indicators with this new strategic plan. So all of this work will be underway now, but beginning in earnest in 2025. So where we landed with a clear vision statement emphasizing access to excellent care. That's music to my ears. It's my favorite part of this whole thing is that clear and crisp access to excellent care. We have given ourselves permission to ask some really hard questions about what we've always done. That's part of these processes, and that's why our consultants were so important. They really challenged us to think differently about our work. And while our end result is not a dramatic change, for those of you who know Park Nicollet Foundation, you might be thinking this doesn't sound too terribly different. What we were given really is a new lens through with which to look at our work, and given again ourselves that permission to kind of stand in inquiry as we look at what we've done, what we can do going forward, and how we might need to adjust and change. And then we landed on a final and approved strategic plan at our August board meeting. So our plan is already underway. We are communicating this to the broader community. So you are part of that today as part of this coffee and chat. We are also engaging with internal stakeholders. So as I meet with different leaders across the system, I am sharing our strategic plan so that folks have visibility to where we landed. And then a couple of key things that have started already. So we approved the strategic plan in August, and we did not waste any time really starting some of this work. One of the big projects we did was our Foundation Fest in November. So this was a time for us to raise awareness of the foundation internally, to really help our colleagues and partners understand the role of the foundation and the resources that they have available here. So we had a week-long festival here at Methodist Hospital. We had a partner showcase where many of our partners, some of whom are on this call today, came and shared the partnership that they have with the foundation. We had a show me the money session. Myself and my colleague Pete McNabb walked through the granting process here at Park Nicollet so that people could understand, if I wanted to explore a grant, what might that process look like, and what might my next steps be? We also provided an estate planning 101 session and then did some tabling up by the cafeteria. We had folks play bingo, we had our caring canines and our volunteers. It was a really fun week and a great way to raise awareness of the foundation internally. We're hoping to take the learnings from that and take the show on the road across Park Nicollet. So while that sort of week-long project worked well here at Methodist, we know that that might not work in some of our other clinic and ambulatory settings. So we are adjusting, and we'll be taking the show on the road in 2025. I mentioned as well that comfort cart rounding really showing up for our colleagues and their well-being. We have been increasing our attendance at internal celebrations. In fact, just yesterday we had a Daisy Award winner on 3 North here at Methodist Hospital. So we are, as a foundation, really trying to be present at those events. We're also improving our granting experience, really looking at that process of how our colleagues request funds, and then also the back end of how do those dollars move throughout the system. And then building a deeper partnership with our Health Partners Institute colleagues. There is so much opportunity and potential there for us to continue to grow that partnership. And then we are currently in the process of evaluating the business models for our community programs, as I mentioned earlier. And then, of course, we are implementing our 2025 annual plan. So while this is a plan that will take us through the next 3 years, we have already gotten started and are just looking forward to a really great new strategic plan that will take us into our next 50 years. So with that, I think we've got a few minutes, and I'm happy to take any questions that may have come in through the chat.
Absolutely. Well, Hayley, thank you so very much for your wonderful presentation, and just
You bet.
being, for myself, being on the Park Nicollet Foundation team. It's such an exciting time with the strategic plan in place. We do have one question here. How does Park Nicollet Foundation's strategic plan set us apart from other healthcare foundations in the area?
That is a great question. You know, it was interesting going through the environmental scan. So our consultants did a lot of that, but I created a lot of the questions I wanted them to ask. Um, and the overwhelming response we got to our questions was, "Can you please share what you learn with us?" So I think there is generally a lot of curiosity about how healthcare philanthropy works across the Twin Cities. And all of us that are doing this work in our different pockets, whether it's Alina or M Health Fairview or Essentia or Centricare or here at Health Partners Park Nicollet, I think we're all trying to kind of figure out what this looks like and what each other is doing and what we can learn from each other. So I would say that I got the sense that our strategic plan, people were very interested in what we were going to be leaning into. They were very interested in the way that we conduct our work. And I think we're certainly not unique in having a strategic plan. I think several of the others that we talked to have strategic plans. But we're all feeling the pressures of the challenges of healthcare right now. And so we're all being asked to really step in different ways than perhaps we have before. And so I think there's genuine curiosity about what our plan looked like, but I would say that's really reciprocal. I'm also very curious about what others are doing, and there's great opportunity for us to learn from each other. So um, I don't know that it necessarily sets us apart in having one, but ours is very clear. I think we've given ourselves some good guardrails and some good priorities moving forward that will help us as we continue to work through some of the challenges in healthcare. Good question.
Yeah. Thank you. And I also had another question. You had been in your presentation had mentioned that one of our key initiatives will be communicating the strategic plan, excuse me, out to the public through means like this coffee and chat. Can you speak to moving forward in 2025 what you envision, how we'll go about that with communicating to
Yeah.
the public our strategy?
Yeah, you bet. So already we've shared this with our retired physicians group, with the St. Louis Park Mental Health Collaborative. So any groups that want to hear about this, we are happy to take this show on the road and kind of walk through. We will be talking about this all the time. I think well, sometimes strategic plans are done and then they sit on a shelf and nobody ever looks at them again. That is not at all the intention of this plan. We are really hoping that this is a living document and a living sort of project that our board and our team look at really regularly. So I expect that our community, both internally and externally, is going to be hearing about our strategic plan all the time in different ways, in different bites, in different sort of pockets. But this sort of larger rollout, I'm doing to whoever is willing to listen. So if anyone has any groups that are interested, I would love to take the show on the road. But we're really trying to make sure that our donor partners and our funders have already had access to this and have seen the documents and have had an opportunity to ask any questions throughout. Yeah, good question.
Thank you so much. And let's see here. Another question we have here is, let me see here. I just saw one pop up. One moment. Let's see here. Oh, yes. Okay. So another question that I wanted to ask as well is with the role of our community programs and how that ties into enhancing the patient experience, both internally and externally within Park Nicollet, are there any community needs that you anticipate that our granting will end up supporting or future programming that we are not already supporting at this time?
I don't think I have an answer to that yet. I think that's work that we're gonna be doing over the next couple of years to really figure out where are those needs. We know that for many, Park Nicollet is a resource for healthcare, and for sometimes for healthcare questions that we don't even that we're not necessarily the provider of. So one example of that is when folks come in for a primary care appointment now, many will receive questions. I know my family has of, do you feel like you have a safe place to stay? Do you feel like you have, you know where your next meal is coming from? Really trying to learn more about our patients and the critical and necessary things that we all need in life. And so while we have patients who certainly have food insecurity, there's likely not a world where Park Nicollet Foundation starts a food shelf. However, there is a world where we would support local food shelves who know how to do that. They are experts at that work. And we know that we want to support our patients in all parts of their well-being. So I do think that those are the types of things that we can explore in addition to looking at our 3 community programs and how do we make those more sustainable and build plans for the future for those. So I think it's kind of a both and, but it will be evolving as we learn more about what our community needs and how we can step in.
Thank you so much.
You bet.
And Hayley, if anybody has any other questions that you can think of after this presentation, I'm happy to forward them over to Hayley after this if you don't want to reach out to her directly. But we just wanted to say thank you so much to everyone for joining the call. And Hayley, thank you for your excellent presentation and leadership with this strategic plan. And just speaking from a team member's perspective, like I said, it makes me really proud to be part of this team. So thank you so much, and I hope everybody has a great day. Bye-bye. Thank you.